Childhood absence epilepsy, or CAE, is an epilepsy syndrome with absent seizures that typically begin in middle childhood between the ages of 6 or 12, but has been seen to start as early as 3. Many children may grow out of it. The condition often lasts throughout adulthood. These seizures cause a short period of blinking out or staring into space caused by brief abnormal electrical activity in a person's brain. During these seizures, they are unresponsive and have repetitive movements. Generally, they last around 10 to 20 seconds before ending abruptly and can happen up to 50 times per day. CAE accounts for about 2 through 8 out of 100,000 children under the age of 15. This condition is more common in girls than in boys.
Primary diagnostic criteria for CAE is being a young child with staring spells or attention problems. Additionally, doctors can complete a physical exam to look for problems that may have an association with the seizures. Beyond this, there are also CTs and MRIs to check for a normal brain scan and also EEGs to look for possible seizure activity. The prominent risk factor for CAE is genetics. About 1 out of 3 families of children with CAE report a family history of absent seizures or other generalized seizures. Besides lifestyle medicine, there's one primary protective factor: avoiding hyperventilation. This is a seizure trigger that can occur after anxiety, panic, or even emotional stress.
During an absent seizure, the child's awareness of what's going on is affected, considering they don't even know that the seizure had happened. Apart from the seizures themselves, symptoms include negative long-term effects on memory, attention, concentration, and learning, as well as problems in normal development. For effective seizure control, medications such as Zoroatin and valproic acid are prescribed. Zoroatin is typically used first since there are positive responses with minimal side effects such as nausea, vomiting, and hyperactivity. Valproic acid is also effective, but side effects include nausea, attention problems, increased appetite, and even weight gain. In general, combinations of these medications are prescribed if the seizures continue. However, taking multiple medications can cause tiredness, stomach upset or discomfort, dizziness, or even blurred vision.
While physical activity is important, children must avoid overly strenuous activity as hyperventilation can trigger absent seizures in young children. Stress management is also key because physical, mental, or emotional distress are also triggers. Lastly, within the topic of lifestyle medicine, a ketogenic diet can also be utilized. This is a specialized, high-fat, low-carbohydrate diet that decreases seizure activity by mechanisms not fully understood.